Hi, my name is Dr. Forrester Dean. I am a chiropractor, physiotherapist, and primary care physician practicing in Manhattan Beach, California. In this episode, we are going to discuss download number 6 called Physician's Referral to a Surgeon. So please go to the website, betterpatientsolutions.org, click on the Services tab, scroll down to the picture of the interns, and now we're in the next category, medical networks. Number 6, physician's referral to a surgeon, and then scroll down to download number 6. Click on that, go ahead and download that right here and print that out. So here we have download number 6. So the download number 6 I created because I think that patients have a misconception that when they go to the primary care doctor, their records and everything they said and all their chart notes are going to appear at the referral doctor's office, and that the referral doctor office, that doctor is going to read all of the chart notes before they walk into the exam room to see the doctor, and that this referral doctor is going to be very well prepared to discuss their complaint. And that's not how it works. So I created download number 6 so that you are ready to jump into action with this next interview. So now you've been from your primary care physician, you've been referred maybe to some imaging or not, but now you're being referred over to the next appointment, which is this referred doctor or surgeon. So this doctor or surgeon knows nothing about you. That's where you need to start. So I recommend that you reprint and fill out downloads number 2 and 3 and 4 at a minimum, to bring with you to this doctor's office and quickly review these with the doctor right away. If the doctor starts to talk to you about your problem and does not take any time to get to know you as a person, doesn't ask you about your values or your expectations, then you need to jump in and advocate for yourself. Now remember, usually you're going to this consult because this is a specialist, and typically these doctors are more focused. Their education, the concentration of their practice is on a very specific topic, and that's why you're going to them. So you really want to take advantage of their education and their knowledge by being really prepared. So I have created here on this worksheet, number 6, a statement that I highly recommend that you read to the doctor. I'm going to read it to you now. I understand that I was referred to your office for a surgical consult. I am interested in your diagnosis and how you will arrive at it. I understand that special imaging plays a very small role in diagnosis according to current evidence done by important medical doctors. I understand the exam and history provides at least 90% of my diagnosis. I prefer to save time and money by using exams and my history. Do you feel qualified to do a high-quality exam and discuss the value of the exams to me while you do them? And then you're going to circle here, doctor says yes or no. So why am I having you read this? Because it's very hard for a patient to be in this very stressful situation of being in a specialist's office and for the patient to advocate for themselves. Usually specialists they're kind of sometimes thinking a lot more of themselves. I'm trying to say in a polite way. So you're going to ask the doctor after he does the exams, what is your diagnosis? What is it in plain English? And now this physician, this specialist, is going to be giving you specific treatment plans. Specific. They're going to recommend drug options, surgical options primarily, and probably not conservative approach options. And this is where I want you to focus. I'm recommending, for best outcomes for yourself, to focus on conservative approach options. Ask the doctor. If the doctor has no idea what you're talking about, then you need to go back to your primary and you need to talk to your primary care provider about that problem. The doctor's recommendations go here. I also recommend that you make sure, like I've said before, if they make a recommendation, that you go into a specific treatment plan where you buy certain medications or sign up for certain procedures, that you understand that those procedures are in your plan, they're covered by your plan. Even if you, let's say you do really need a surgery, is the anesthesiologist part of your group or part of your plan? They may have hired out the anesthesiologist and they're not in your plan. And now you've got to come up with $3,000 cash for the anesthesiologist to pay their bill. So make sure you understand the totality of your bill, every step of the way. What are my out-of-pocket costs? Can those be reduced? What are the costs for my treatments? Can those be reduced? Okay, and then I want you to ask this surgeon, what happens if I don't get better? Right? Like, okay, so you're going to do something, and what happens if it doesn't work? Do I get my money back? Are you going to do something else for free? Like, are you going to step up to the plate and guarantee me some kind of I don't know, research or personal guarantee that I'm going to get better? Like, to me, that's really bold. I ask that, and the patients who come into my office, when they need to go to a surgical consult, they ask these hard questions, and I know they're not easy, but they're important for you to advocate for yourself. So use download number 6 to help you at your surgical consult. My name is Dr. Dean, and I look forward to helping you out with the next download. Thanks.